Welcome back to the Better Health Now podcast. Today I have the opportunity to sit down with Desiree Washburn, a sleep medicine specialist here at Coleman Regional. Thank you so much for joining me.
Thank you for having me.
Yeah. So before we dive in and talk a little bit about sleep medicine, sleep studies, talk a little bit about your journey to get here to Coleman.
Well, I'm actually from Coleman. So graduated from Coleman High School in 2001. Actually worked here at Coleman Regional during high school in medical records. So back before the days of an electronic medical record, I was your friendly face who helped alphabetize ER and one-day surgery charts. So
Wow.
I've been around a long time. Actually went to nursing school at the University of North Alabama. So after graduation here in Coleman, I moved up to Florence and lived there for about 3.5 years while I finished up my degree. Came back here to work in the operating room as an RN, and then re-enrolled in school, went down to UAB and got a master's degree as an acute care nurse practitioner.
Wow.
During that time period, I worked locally in the operating room and then also at the urgent care in town, and came back here to work in the emergency room. So I started in 2008 here in the ER as a nurse practitioner and worked until around 2020. After that, of course, it was the beginning of COVID. So I did work in a few different settings, including urgent care, pediatrics, and then ultimately settled in sleep medicine and pulmonology. I worked in that area for about 2 years and then came over back to Coleman Regional to work for their sleep physicians and their pulmonologists.
Wow.
I came back around September, August of last year and have been working with Dr. Bullard, Dr. Murray, and then also Dr. Tapazzoli.
Okay. Wow. It seems like that full circle sort of experience here in Coleman, and then going away, and then coming back, and then you've done a variety of different roles. So it's exciting just to kind of see where you are now in your career, and I'm excited to kind of dive in and talk a little bit more about sleep medicine and sleep studies. What are some of the common signs for people that that a sleep study might be a good thing, and what are the benefits that come from a sleep study?
Well, the biggest thing that probably our biggest referral source is for snoring or for pauses in breathing at night, or, feeling like your family member is choking at night and not breathing well. Most of our referrals come from wives. We do receive quite a few referrals from primary care physicians as well as even from surgeons because patients have difficulty when they're in that recovery room setting, when they're waking up from anesthesia. You're not usually having someone watch you sleep, but over there you do have an RN watching you. So a lot of times they'll recognize those breathing patterns or drops in oxygenation or snoring. So we get a lot of referral sources, but it usually stems from someone saying, I sleep all night, but I feel unrested when I wake up. I feel like I could sleep 12 hours and still feel tired the next day. And a lot of that's because of what's occurring at night when you're pausing in your breathing, you're snoring loudly, and your oxygen levels are dropping. It's causing you not to be able to go through the correct sleep cycles as you should and get that restorative sleep that we all want to have.
Yeah.
So it's kind of a common denominator, but multiple referral sources. It's not as common for you to refer yourself because you don't always recognize the symptoms as well as someone who sees you sleeping, such as your wife or partner.
Yeah, and it's nice to hear that it's not necessarily like a doctor has to refer you. It's just if someone's notices it, your spouse, your wife, if you're in a recovery, like that process of being able to come in and say, hey, like you really need to get a study. I can't sleep. This is not working. Like whatever that might be. What does that sort of the process look like as far as scheduling that first sleep study, and then kind of the journey that the patient goes on up until that sleep study day?
We know there's a few different routes, and luckily we're able to accommodate all those routes in our clinic. So we have the option that you just, as a patient, call and say, hey, I need an appointment. There are very few insurances that do require a prior authorization or a referral. So if you're one of those few, we're going to contact you and help you get that process started. If you're not one of those, you just schedule your appointment, pick that date and time, and then come in and see us. There are primary care physicians who refer patients to us. Specialists such as cardiologists refer patients to us, surgeons, as I mentioned. They would just fax over a referral to our office, and then our schedulers would reach out and schedule the patients. But we have a third process that is really helpful for patients who need to go on and get that sleep study, such as our truck drivers, pilots, people who need that sleep study done quicker.
Mm.
And that's called a direct referral option. That's where primary care doctors, surgeons, or specialists can actually refer the patient to our sleep center to have the sleep study first. Our sleep physicians interpret that, and then they set up the appointment in the office to go over that
Wow.
result. So it does bypass some of that waiting process for
Mm.
scheduling, and it's really important for those folks who are either have an upcoming surgery, a DOT clearance, or a FAA pilot clearance that they
Mm.
need to get that sleep study moving a little quicker. So we have a lot of options that are available to our patients to be able to get them in the office, seen quicker, studied quicker, and hopefully, moving along with their
Yeah.
life like they hoped for. Because, that's the ultimate goal. We want everyone to have better sleep and then feel better throughout the day and have better just daily functioning at whatever your occupation is.
And so that day of, so if the patient, scheduled the appointment, they meet with you prior to having their sleep study, they come in for their overnight sleep study. What does that that entail for the patient? What is the experience like? Are they just wires everywhere to like track everything? Or what does that look like?
Well, this is usually how I explain it. So you'll pick your date. That's the date that works best for you, whether it's a day that your kids are out of school or that you're off work. You pick that date, and then you come in after dinner that night. So whether that's between 7 or 8, our sleep center would tell you the specific time for your arrival. You come in, you can already be in your PJs if you like, your lounge clothes or, anything like that. They'll hook you up to monitors, but they're not huge, cumbersome ones like what
Mm.
people remember from 20 years ago with sleep studies. Obviously, technology has improved. So you will have some leads on your chest, your arms, your legs, and then on your scalp. Those are checking your brain waves, your heart rhythm, your
Mm.
oxygen levels of your blood, your arm and leg movements. Those are all giving so much wealth of information to our sleep technicians and then ultimately to our sleep physician that we're checking you for more than just sleep apnea.
Mm.
So we can see if you're having arrhythmias overnight. We can see if your oxygen levels are becoming too low at an unsafe level. We can see how much your legs move at night. And that's how we diagnose things like restless legs or periodic limb movement disorder.
Mm.
And we can actually treat that as well
Wow.
when you come into the office and we give you those sleep study results. So it's a lot of wires, not as much as people really think or that they have had in the past,
Yeah.
but it gives so much information and it's such a great study to have.
Yeah. And so from having that sleep study done, doing the overnight to then getting the results, how long is that process typically for the patient?
Usually, so the sleep study itself is usually just a one night study to diagnose sleep apnea. We have other studies called split nights where you may come in the first half of the night, they're diagnosing your sleep apnea. The second
Mm.
half of the night, they're doing what's called a titration. They're finding out which pressure is best on CPAP or BiPAP to manage
Mm.
your breathing. So once you have that test, whether it's done in one night or done over a period of 2 sleep studies based off how they need to space that, it's about a 2 to 3 week turnaround for our sleep physicians to receive the fully scored sleep study
Mm.
and then be able to go in and make appropriate diagnoses and then, make pressure setting orders
Mm.
that would best fit you. So it's not a, one size fits all.
Mm.
Everyone's care is tailored to them, to their breathing, and to their sleep apnea. So there's a lot that happens in that 2 to 3 weeks after your sleep study, but it's well worth that, wait to get good information. So once you see me, it's about 2 to 3 weeks after the sleep study, and we go over all that in detail.
Mhm.
We make sure that we have a treatment plan that's, fine tuned for you and for your sleep apnea or whatever condition we may diagnose. And then we can actually get you set up on the CPAP device or BiPAP device same day in most
Mm.
instances. So we would actually fax over an order to
Wow.
CPAP Care or whichever DME provider you're using for your CPAP, and they would be able to set you up that same day on that correct pressure.
And CPAP is typically what most people think of when they have, after they have a sleep study, kind of the main treatment. But there is a variety of other treatments that can
Yes.
help, just depending on the need. Like you said, it's not a one size fits all. Every patient's a little different, and what's
Mhm.
best for them. If that CPAP is sort of the next step for them, what does that process look like for the patient to get that referral or to get that sent over to get the machine all set up and all of that?
Yeah, so we actually can fax the orders electronically, so you don't have to carry your old fashioned paper prescription over. We do have those available, but you would take your prescription for your PAP device to your DME provider or it's faxed ahead. You show up and they actually let you try on different masks based
Mhm.
off which one you did best with during your sleep study. So if it's a nasal mask, you'll try on different style nasal mask. If it's a full face mask, you try on different masks. They'll find the one that fits you best, get you started on that machine at that correct pressure, and then you would come back and see us a month later.
Mhm.
After that month, we'd have a full month of download from the device that shows us how well your CPAP is managing your sleep apnea. It'll
Mhm.
show us um, if you're having shortened or longer sleep with your CPAP. It'll show us if you're having good control through the use of the CPAP. And then that's also when we talk about, how are you feeling with this machine? Do you love
Mhm.
it? Do you hate it? Is it something you're going to grow used to, or is it something that we need to fine tune further?
Mhm.
And there are instances where people can't tolerate CPAP or BiPAP. So they come in and they say, hey, this mask is just not for me. I'm feeling
Mhm.
claustrophobic, or I feel like it's just, it's blowing too hard of a pressure and I can't tolerate it. And that's when we help you go down those lines of, okay, what's our next step? What could we do that's not CPAP to
Mhm.
treat your sleep apnea? Do you meet the criteria for other treatment options? And those include like the dental device called Somnodent, which is almost like a retainer that fits in your mouth and it keeps your
Mm.
airway open to hopefully prevent your sleep apnea spells. Then we also have now at our option is Inspire, which is a implantable device
Hmm.
that actually has an electrode that goes up and moves your tongue and your neck muscles out of
Wow.
the way so your sleep apnea is not happening.
Wow.
So you do have to meet criteria for all these
Mhm.
other sleep apnea treatment options, but it's nice knowing that there is a tailored plan for
Yeah.
you and that there are options, because what's good for one person is not always best for everyone else. And that's probably what I spend a lot of my time doing, is discussing with patients what our options are. And then also, they've always talked to their family members, their friends, and hey, my friend tried CPAP and he just could not do it. I don't want to try it either. We try things just to see, because
Mm.
everybody has a different response, but we're also help meeting, other needs and other criteria to get you potentially referred for a different treatment option
Mhm.
if it doesn't work. So it's really a good process to go into with an open mind and try. And we're not going to, force a CPAP on you if you can't manage the pressure or you can't wear the mask. So it's a great time to sit down, talk to us, and work through that process.
So, has as you know, like what we were talking about a little bit about it off air, but like with wearable technology and a lot of things, you tracking your sleep and like having results with Apple Watches or Garmin's or whatever it might be, has that increased the popularity of people coming in from seeing something on those devices and then saying, "Hey, I'm having an issue," or how accurate is those wearable devices in leading someone to come in and say, "Hey, I should get a sleep study."
Yeah. So here's how I feel about them. I think technology is better than nothing.
Mm.
So I don't feel like the Apple sleep watches or the different wearables are as accurate as a sleep study by any means,
Mm.
but I do think they give folks an idea of how they're doing, and it's nice to know, this is the number of hours I slept, or this is how many times I woke up, or this is what my heart rate looked like while I slept. I think those are great cues into finding, hey, I may have a little problem here.
Mm.
But I don't think once you've had an official sleep study and you know your results, that is going to be near as relevant information as the actual sleep
Mm.
study or the download from your CPAP device, or in the case that you have an Inspire implant, the download from your Inspire implant. So I think all these things working together are great for patients, but I wouldn't use like my Apple Watch, and I'm wearing one now. I wouldn't use it as my be all end all for
Yeah.
how well my sleep apnea is managed or whether I have sleep apnea or not. So there's a lot of different, tech that I think helps us in daily life, but there is better medical technology out
Mhm.
there, and that sleep study is just going to give you more information than that Apple Watch.
Yeah, and you obviously CPAP is sort of the most common one that you probably see as people coming through.
Mhm.
With that implant, that's such an interesting technology. How often are you at Coleman Regional, are you finding that a patient's best fit is the implant?
I would say it's so patient specific. I wouldn't give it a good number. I would say that we refer over, several each week
Mm.
to the Inspire surgeons for evaluation. not all patients are candidates. So
Yeah.
we have to do a pretty hefty screening process to make sure that, that they're a candidate, that, their insurance is going to allow them to go have that referral done and get evaluated by that surgeon. And then ultimately, the surgeon makes the final call of whether they meet all the criteria for their airway for them to have the implant.
Mm.
So it's probably not a number I can just, pinpoint yet. I do think those numbers are increasing.
Mm.
We're seeing more patients who learn about Inspire and they're coming in asking for it by name and saying, hey, I tried CPAP all these years ago. I just couldn't do it.
Mm.
I recognize that treating my sleep apnea helps improve not just how I sleep and how I feel each day, but my blood pressure, my acid reflux, my other health conditions. So
Mm.
they're coming in and asking for it more, which I think is great because that shows that the public is getting some knowledge about what their treatment options are. And I think you're going to see more Inspire implants going forward. But again, it's just going to be it's case by case
Mm.
specific for who it works great for. But certainly, if you've tried CPAP in the past and it failed for whatever reason, get back in to see your sleep specialist. Come see us. Let us take a look at you and look at your specific situation and see if there's another option out there for you.
Yeah, and so we've alluded to it a little bit throughout this conversation, but there's the impact of a sleep study and this and impact on good sleep for anybody. It has a lot of different factors that factor into their life.
Mhm.
What do you hope that people would understand that hey, we're not just fixing your sleep, we're not just making sure you sleep better, but we're also fixing and helping you with other elements of your life.
Well, I mean, it's been shown that, treating sleep apnea really helps prevent other major health problems. So, one being stroke, another being, of course, hypertension, acid reflux, heart attack, pulmonary embolism, DVT. There's a lot of things that have been shown to be caused by untreated sleep apnea.
Mhm.
One of the more recent studies was about early onset Alzheimer's. There are so many preventable complications that occur as we age that we could really be treating proactively. And I think for a long time, sleep apnea was something that was kind of the last thing that we thought
Mm.
of, whether that was us as patients or us as healthcare employees. But I think now people are seeing, oh my goodness, this really helps all these other
Mm.
conditions. And I think family physicians, internal medicine doctors, surgeons, specialists, everybody's thinking more about this now when they see that patient with hypertension or they see that patient that's had a heart attack. So I think that what we're really trying to do is tie all this in together and make people understand that sleep health is important. It
Mm.
is going to help your other conditions and prevent those, just catastrophic conditions that people have. I want us to think about sleep health before we have that heart attack or before
Mm.
we have that stroke. It's a lot harder to treat those conditions than it is to prevent them.
Mm, yeah, and I think, this the whole conversation of just, the mantra of the podcast, the name of the podcast, Better Health Now, is something that the impact that you're having in your patient's life is evident. I feel like most people that I hear about having a sleep study and getting some treatment is night and day difference. And
Yes.
and it really does have an impact not only on your health, but also on like your functioning through your ability to function throughout the day. I appreciate you being here today. I feel like I learned a lot more about just the different options for people and the importance of getting a sleep study. One other question that I think is probably a question that I'm interested to know about, but maybe other people are too, is there an age that you see most people coming in to have a sleep study, or is there an age you recommend, or does it really, depending on if the patient has sleep apnea, that hey, maybe that there's not necessarily an age that is the most likely to get a test done?
Well, I'm glad you brought that up because most people don't know that even children can have sleep apnea.
Mm.
So we actually do see pediatrics. We see, from age 3 up. So we see pediatrics, we see teenagers come in with referrals.
Mm.
Most of the times, those are going to come from something mom's noticed. Hey, I
Mm.
noticed that my child is having, interrupted breathing or she snores so loud, I want you to get a sleep study. So we're seeing that age group more now than used to.
Wow.
And it can actually help us identify sleep apnea or even help refer to an ENT physician for a tonsillectomy,
Mm.
seeing oral airway problems causing the snoring or the sleep apnea. I would say our most common age is probably going to be like that middle age group. So
Mm.
and I'm in that group as well. But we see a whole lot more of our late 30s, early 40s, early 50s patients come in.
Mm.
And that's because that's the group whose their spouses notice it. And they're saying, hey, I notice you're snoring all night. You're keeping me awake. You're not breathing. I'm afraid you're going to die in your sleep because you're not breathing well. That's the kind of referrals we see the most
Mm.
of. But certainly sleep apnea, it hits all ages. So we see anywhere from age 3 all the way up to 99. So
Wow.
I think that I wouldn't classify it as a certain age group as much as just the more common age group that we see referred over
Mm.
or self-referring are that middle-age group.
Awesome. Well, we'll be sure to have everything in the episode notes. If anyone wants to find out more information about the conversation that we had today, find out places to even book an appointment and get all that done, we'll be sure to have that there. But I appreciate you being here today.
Absolutely. Thank you for having me.